Our lovely patient, who's 44 years old, is several months out from her breast augmentation and mastopexy, which is a lift, as well as about a month later, a full abdominoplasty. And she comes in today very graciously agreeing to share some of her thoughts and feelings about what she was hoping to achieve and how she feels about her recovery.
So after a significant weight loss and after having 2 kids, I had a lot of extra skin on my stomach. I had some laparoscopic procedures, had a lot of scars on my stomach. My breasts were saggy and pointing downward. So I came in hoping to do the mommy makeover, which I did. Very happy with my results now. I had small implants in the lift. They're very high. I can not wear a bra and everything looks great in dresses and tops. The stomach looks fantastic. I am back to doing everything I was before the surgery. I look great in clothes. My thighs look improved. I'm down a couple sizes now just from the tummy tuck, and very happy with the results.
That's so great. That's so great. What were some of your fears and apprehensions as you moved into this process?
I was afraid of the pain, which, for the first couple of days, of course, there's pain, but very quickly was back to normal. I think within a week I could get around without any issues after the abdominoplasty. Obviously worried about complications, but I had none, and worried about scars a little bit, but they're healing very well, and it doesn't bother me at all.
Perfect. In terms of what you were looking for in your hopes and aspirations, what were some of the things that were frustrating you about where you were, and what were some of the things that you were hoping to achieve?
I was frustrated with always having to wear a real push-up, like a push-up bra, like a big push-up to really get things where I wanted them to be. I had some asymmetry, and I didn't like that. I really hated the way I looked in any sort of tight pants or tight skirts that you could see the extra skin. And now, I have none of those. I threw out my compression undergarments that I needed, underwear. And again, I can wear the cute little bralettes now. I can go braless if I need to in a backless dress. So
It's fantastic. One of the things that I've really pioneered and felt very passionate about is providing the abdominal surgery without the use of drains and allowing patients to have a drainless recovery. Can you shed a little bit of your insight as to how this impacted your selection of which operation you wanted to have done?
Sure. I mean, I was doing a lot of research on a lot of message boards and different social media groups, and saw pictures of people with the drains, and it definitely looked like something I didn't want to go through. And then in doing my research, saw with the drainless, the much better results you get, that everything looks so much better, and it looked like the healing process and the recovery time was much better. So after I realized there was a drainless procedure, that was really the only thing I wanted.
I love it. You and I talked a little bit today while we were examining your belly about your belly button, your umbilicus. Share with me some of what your observations were leading into this and how you feel about your belly button.
Sure. I had seen many pictures online and had read many stories from people of how much they disliked their belly button because it looked fake. They had big scars, or they had to have revisions. That was the biggest thing I was seeing. So, to keep my own original belly button was fantastic. It looks completely natural, which it is, and you can barely see a scar. And again, I'm only 3 months out, so I'm sure it's only going to get better. But it looks completely natural. I don't think anyone would ever be able to tell unless I told them.
That's fantastic. Share with us a little bit of your feelings about the comprehensive DVT prophylaxis, and DVT stands for deep venous vein thrombosis, or the blood clots in your legs, because we have a pretty comprehensive program for this. And share with me, number one, how did it make you feel? And number two, was it awkward to pursue?
That was a big, I had read many many stories of people either going out of the country or, getting, I'll say, discounted procedures, which I wasn't going to play around with my health and my body. And so, going through all the procedures that we did before I had the actual surgeries, made me feel very comfortable. I mean, you were very thorough with my health history, my family history, to determine if I was at higher risk, and if I was, there was extra protocols to go through. Giving myself the injections after the surgery wasn't bad at all. I appreciated having that peace of mind that I was going to be healthy and see the positive results from my procedures.
Well, thank you so much for sharing your story, and really you're an amazing example of a lot of prior planning and excellent, I don't want to say execution, but excellent delivery of what was the intended option. So thanks so much.
Thank you. Appreciate it.